So you asked me to articulate the case, the neurosurgical case for a formal national expert MDT. And this is what we've been talking about this morning. The question really is, what is best practice for a condition that is rare, very rare in children, that needs highly specialized expertise, it's difficult to manage, has multiple treatment options, is widely multidisciplinary, it involves complex anatomy and surgery, and most importantly, as we saw today, has high potential for disability, which can be endocrine, cognitive, physical, or metabolic. And the solution for this clearly is big national teams of experts discussing cases together. And these have become known as national advisory panels. And the first advisory panel, or MDT, to take this role was in 2011 for national Ewing sarcoma MDT. But since then, there's been many more. For ependymoma, neuroblastoma, there's a long list there. The one that's probably most similar to what we're talking about today is the EMAG, which is the advisory group for ependymomas in children. Ependymomas are also rare diseases. They are very surgical in that there's a big difference in outcome depending on whether they've been completely removed or not. And this group has been very successful over 10 years. It was initially funded through the SIOP-E ependymoma 2 trial, but funding now actually has run out. And it provides expert consensus, not individual opinion. Recommendations from EMAG are usually implemented, and it's actually now, these days, it's almost inconceivable that a child with a new diagnosis of an ependymoma is not discussed in EMAG. Of course, the problems with pituitary tumors and suprasellar tumors, as we've been discussing today, is that there's multiple surgical options. There's the transphenoidal approach, transcranial approach, endoscopic approaches. There's a big issue as to whether surgery should be radical in some cases or conservative in other cases. The radiology is complex. These are tiny. The pituitary gland in itself is small. It's a very focused, small area on a scan, which requires expertise to see. And in addition to all that, there's the role of proton beam therapy. Do you do it early? Do you do it late? And all this needs to somehow be brought together by a team of experts, ideally at the beginning of a patient's journey. And so the optimal surgical solution, we think, and I have actually spoken to quite a few surgical colleagues around the country about this, would be to have a weekly HPAT. That's the same meeting that Hongwei was talking about earlier. And a weekly HPAT will allow a timely discussion, so doctors and consultants do not feel that they need to wait a month to discuss a relatively urgent case. And this would have dedicated time for surgical discussion and options at each week. It will be multidisciplinary, which must, of course, include, as we saw today, adult pituitary neurosurgeons. And it should just be available not only at diagnosis, but also at recurrence to discuss toxicity of treatment and also to review complications of surgery, chemotherapy if used, or even radiotherapy. And the benefit would be that it will reduce variability and should hopefully improve outcomes. There'll be a discussion of different options. Some of these children have gone through a long journey already, and there may not be very much evidence to guide what to do at a late stage, for example, in a child with craniopharyngioma. And having a team of national experts discuss these patients would clarify what management should be available beyond the evidence that is clear. And it would also be important to build a registry and collect data on outcomes. And in fact, EMAG is now beginning to build data on surgical outcomes, which is really important for ependymomas. So can this just happen, or does it need to be commissioned? Well, we would argue that it would need to be commissioned and job planned. And that's because there's administrative cost to this. We can't have Hongwei's PA doing this forever. There's a lot of time related to preparation and review of radiology. You need expert radiologists who are familiar with this sort of area in the brain. And also for longevity and reliability. We cannot have an HPAT struggling when Hongwei's PA retires. And so reliability of these meetings is important, especially if they become responsible for a registry and data collection. Thank you very much.